Hey everybody, Dr. Chris here. Thanks for joining me. This session, we're going to go over nutrition. Okay, nutrition is a huge topic, right? We could talk about nutrition for decades. People have been talking about nutrition for decades, for centuries. Okay, we're going to have a couple minutes here. We're not going to get anywhere past the surface. We'll just kind of look at the surface from high above and just hit some of the high points here, kind of how I think about nutrition, how I think a lot of people should think about nutrition. So this is going to be in generalities, okay? Now, when I say generalities, I mean this is a good foundation, all right? This is almost everyone where I start. If we get this foundation down with the nutrition, well, then we can play around with it a little bit. This might be all you need, all right? And some of this stuff you can start implementing, I mean, maybe even before this talk is done, right? Or definitely shortly thereafter. We get this foundation down, start working on it. You're not noticing changes, then we can adjust things a little bit, see how you respond personally, okay? You're a little snowflake. This might not work exactly for you. Again, life is complicated. Nutrition is no exception. So weight, if we're talking about weight and fitness, so many ways to go about things. 100 of them might work for that person next to you. 5 of them might work for your neighbor. 1 might work for your spouse, and none of them work for you. We gotta find what works for you, okay? And that takes some experimentation, takes some patience, takes some knowledge, but we'll get there, okay? So let's dive into nutrition here. So 3 things I think about when I think about nutrition. The first is how much you eat. That's calories, okay? So everything that you put into your mouth that gives you energy has a certain amount of calories, all right? What's a calorie? Any idea what a calorie is? So a calorie is how much energy it takes to raise 1 kilogram of water by 1 degree Celsius. What does that have to do with your body? Who cares? That's how we keep track of things, okay? So how much you eat, number 1. Number 2 is what you eat. So 2 ways to think about what you eat. 1 is the food choices, okay? So look at all this healthy stuff here. I got some Brussels sprouts, some apples, some cashews, some oatmeal, and so just the general food choices, okay? Now, to be a little more particular about that is the macronutrient composition, okay? So oatmeal, lots of carbohydrates, cashews here, maybe some fat, some protein, and then there's better and worse varieties of that. So for example, you can have 2 foods that have the same exact amount of protein, let's say a lean chicken breast and a hot dog, but one of those is clearly better for your overall health than the other one, okay? What you eat, how much you eat, and then when you eat, okay? So forever we've been saying, eat breakfast, it's the most important meal of the day, right? When I got this hip and trendy intermittent fasting that people are doing, and it seems to be effective, there seems to be some science to back it up. So what's the deal with that, right? So we're going to talk about all these things just in a broad overview kind of fashion. Okay, so I'm going to get into a little bit more now how much you eat. Okay, now this is going to be different for everyone. You look at a nutrition label, it'll say something along the lines of based on a 2,000 calorie diet. Okay, for a lot of people, that's fine. 2,000 calories is just fine. That's enough for them to maintain their weight. And remember, weight's complicated, all right? Life's super complicated, weight's no exception. So even this nutrition, which is broad, is just one piece that affects your weight, okay? There's rest, there's physical activity, all these genetics, all these other things. So this is just the nutrition part. So for most people, or a lot of people, 2,000 calories is a reasonable goal. You do an internet search for weight loss or something along those lines, and one of the most common numbers you'll see is 1,200 calories. Eat 1,200 calories, you'll lose weight, okay? Again, for a lot of people, that's fine. In general, what we do is we take how many calories you need for maintenance, that's how many calories you need to take in just to maintain your current weight, and we subtract about 500 a day, okay? And over a week, you should lose somewhere around 1 pound. Now, often that doesn't happen because it's a rough estimate. There are these fancy devices you can use where you breathe into a tube and it measures your exact resting energy expenditure. So that's how many calories your body uses if you're just laying in bed all day. Energy that it takes to blink, for your brain to work, for your heart to beat, for your lungs to breathe, all those things. And then you incorporate some extra energy expenditure when you're going about your activities of daily living, right? Going to the bathroom, you're eating food, you got to break that down. That takes extra energy. That's different for everyone. A common number thrown out for that is around 500 calories. Again, very rough estimate. And then there's exercise expenditure of energy beyond that. Okay, so how much do you eat? you don't know exactly, there's all sorts of online calculators that you can use to figure out what your resting energy expenditure is. One of the most well validated, most commonly used ones that I use all the time is called the Mifflin-St. Jeor equation. So that one is very good. So just type in that and plug in your numbers and you can go from there. So that's how much you eat. Okay. Next we got what you eat, and this is much more complicated than how much you eat. Is what you eat, because there's so many different things. Okay, so what do we got here? We got apples. All right, apples are good for you. Keep a doctor away. Well, not if you're on keto, right? Don't eat an apple. This is like the wicked witch, the witch from Snow White is handed it to you if you're on keto, right? It's gonna kill you. So that might not be so good. Oatmeal, right? Lots of fiber. It's good for you. Whole grains, Mediterranean diet. Some people, they no way, stay away from oatmeal. Okay, how about cashews? That's good. Healthy fats. You got a little bit of saturated fat. You got some fiber in there. Stuff's got a ton of salt on it. Salt's bad news. Okay, so Brussels sprouts. Brussels sprouts can do nothing bad, okay? Unless you're a kid. So it's very complicated. This, more than any other part of nutrition, is what are your goals, okay? What are your goals? If you say, hey, I really want to use a ketogenic diet to lose weight, well, yeah, you got to be very particular about what kind of macronutrients you consume. You got to stay away from carbohydrates. This much oatmeal, throw you right out of ketosis before you're even done with the bowl. So you got to pay attention to that sort of thing. Now, scientifically speaking, all sorts of diets, as far as macronutrient composition, have been associated with weight loss. Low fat, low carb, low sugar, high carb, all of these have been associated with weight loss if you have a reasonable plan that you stick to. All right. Now, just because it's associated with weight loss doesn't mean it's necessarily good or healthy. Some caveats with that, but just so you know, the macronutrient composition is tremendously important based on your particular goals, okay? And then food quality I throw in here also. That's like the lean chicken breast and the hot dog, okay? So foods that are minimally processed are best for overall health, microbiome health, all sorts of other reasons. Less packaged food is important too. Plastics, some concern about different hormone regulators, disruptors that come in plastics and can seep into your food. So having ideally whole organic foods is best. Like everything, you got to be careful, because just because it says organic or it says natural on it doesn't mean it's healthy, right? I mean, what's more natural and organic than some poison ivy, right? Don't lick poison ivy. Don't try eating that. It's not good for you. Don't do it. So just be savvy about what you're purchasing, what you're buying, and what you're eating. It can be confusing, but do your best. Do things that make sense. Okay, so that is how much you eat, what you eat. Now we're on to when you eat, okay? So there's this database of patients who have lost a lot of weight and kept it off for a long time, okay? Hard to do. So they surveyed these people and they said, what'd you do? How'd you do it? And most of these people weren't, under medical care. They weren't on medications. They were just doing it themselves, however they were doing it. And there were a few things that these people tended to do, most of them did, to lose the weight and keep it off. And one of the things is, guessed it, eat breakfast, okay? All sorts of theories as to why eating breakfast helps, how much it helps, but we know that these people, and it's a big sample size that we looked at to ask this question of, breakfast helps, okay? So for a lot of people, I say eat breakfast. So the rest of the day, what do you do? So eat breakfast, lunch, dinner, maybe a snack in between. If you're doing that approach, you want to end about as early as you can in the evening, okay? The saying is, breakfast like a king, lunch like a prince, dinner like a pauper. So most of your calories should be shifted earlier in the day, which, unlike a lot of things in life, really kind of makes sense, right? You're up in the morning, you gotta fuel yourself for the day, so you eat more in the day, and then you're tapering off towards evening when you're gonna go to bed, presumably, and so you eat less, you need less at that time. So what about intermittent fasting? Well, that's kind of the opposite of what we've been telling people forever, okay? With intermittent fasting, you go a prescribed period of time without taking any calories in, and then you eat over a particular feeding window, the remaining time during that 24-hour period. All right, and the nice thing about intermittent fasting is you can do it one day a week, you can do it every other day, you can do it every day, and it fits with any other diet. You do a Mediterranean with intermittent fasting, you can do a ketogenic diet with intermittent fasting, so it works well with a lot of different things, and people really tend to be less hungry the more they do this, which is a bit counterintuitive. You think, hey, I'm going 18 hours without any calories. I'm going to be miserable and I want to eat my shoe because I'm so hungry and cranky. The first couple of days is very common. Just is a lot of psychological change when you're not eating for people who are used to eating frequently. The number that I like is 18 hours. Probably the most common, if you just do an internet search, is 16 hours without eating, 8 hours over which you're allowed to eat. But I like 18 hours. Some people go 23 hours, just eat over a 1 hour period. So all sorts of different approaches. And there's really good evidence that this is helpful. So there's this thing called a metabolic switch. That is, how easily does your body switch between the fed state after eating, postprandial, when you have glucose in your system, and the fasting state when you don't have that in your system, at least not to a significant degree. And the easier you can flip between these two situations, usually the more metabolically healthy you are and the leaner you are. And so this kind of trains your body to work with the switch on and the switch off, okay? And so this has been associated with better body composition, better blood sugar control, and so other metabolic improvements. So intermittent fasting is definitely an option. All sorts of different parameters and protocols for how you do it. You still want to focus on the other two aspects of nutrition, the volume, how much you're eating and what you're eating, but just do it over that prescribed window. So a common example, again, me using the 18-hour example, you wake up in the morning, you don't take anything with calories, black coffee, water, that's fine. And then between 2 p.m. and 8 p.m., you're allowed to eat. Now, the earlier in the evening you stop eating, probably the better, just like it is with the breakfast, lunch, and dinner situation. And then you just don't eat again until the next day at 2 p.m. All right, and again, you don't have to do it every day, but some days. And it gives you some flexibility too, all right? So, just to quickly review, we got how much you eat, what you eat, and when you eat, all right? Tons of information. We could talk for another couple decades, but I gotta go, so raise your hand if you have any questions. We'll talk afterwards. Thanks for your time.
Be sure to schedule your free 30-minute initial phone consultation by sending me an email or by visiting our website at refinedwellnessconsulting.com.